So, is there a cure for dry eye disease? No. But are there ways to make it a lot better? Yes, absolutely. In today's video, I'll get you as close to a cure as possible in 2022. This is Eye School with me, Dr. D, where I teach you about products and treatments related to dry eye syndrome and eye beauty. I'm an eye doctor that treats patients with dry eye, and I pay special attention to makeup and skincare. I even have an esthetician that I work closely with in my practice. I'm obsessed with helping you achieve beautiful, comfortable, healthy eyes. Make sure to hit the subscribe button if you enjoy my videos, as I do publish weekly. So in the past 12 years of treating dry eye disease, I've spent lots of time seemingly treating in circles. Anti-inflammatories, artificial tears, and warm compresses help for a bit, but never seem to cure the disease. However, in the past few years, new treatments allowing for a more interventional approach to dry eye have completely changed the outcomes I'm seeing in my patients. So first, before finding your dry eye quote-unquote cure, you have to know what caused your dry eye, as these contributing factors are different for everybody. Dry eyes come from a number of factors in your internal environment. So that could be your diet, how much water you're drinking, medicines you take, any autoimmune diseases you've been diagnosed with. So where you're at in menopause matters for your hormonal state. That impacts dry eye. Any dermatological diseases like rosacea and psoriasis may play a role as well. So it's important to control as many factors as possible to help you have less inflammation in general. Secondly, external environmental factors matter as well. So that's why dry eye is usually worse in the winter, for instance, when we have all that forced air happening in our homes and less humidity in general. Environment matters. My patients who work on a computer 12 hours a day and then get to retire and stop the excessive screen time typically see an improvement in their dry eye symptoms from that simple change in their daily tasks. So take note of when your dry eye symptoms are worse and tailor your at-home routine to address those issues or those problematic spots in your day. And that'll be different for every single person. But I'll include my top tips for your environmental changes you can make on screen here to the left. And those are going to include using a humidifier in your home and in your workspace. Maybe getting one of those fancy new thermostats that monitors humidity for you and sends an alert to your phone when your humidity is getting low. You could use a 20-20-20 rule. That's every 20 seconds, every 20 minutes, look 20 feet away for 20 seconds. 20 feet away, 20 seconds. Oh, 20, oh God. The 20-20-20 rule. Every 20 minutes, take a 20-second break to look 20 feet away. You can also blink frequently. Our blink rate on computers goes way down, and so reminding yourself to take blink breaks every 20 minutes or so is a good thing. And then finally, limiting your screen time is very helpful as well. So the treatment of dry eye disease and trying to cure it can get super confusing. I often have patients show up in my clinic with bags of drops they've tried, and it certainly can be overwhelming. But I believe that we overcomplicate it. Simply put, we have to optimize our environment, control inflammation, and sometimes that's with biochemical intervention, prescription medicine. And then we need to clear the obstruction of the meibomian glands. So simplifying it, manage your inflammation and clear your obstruction. That's all we're trying to do. Now, yes, there's a few different ways to clear obstruction. There's a few different ways to manage inflammation. But at the core of it, what are you doing to manage your inflammation and clear obstruction of your meibomian glands? Working on your at-home therapies can optimize your environment, control inflammation, but here are my favorite treatments to help clear the glands. So lid exfoliation is done to clear the glands of mechanical debris like blepharitis, but it also works to clear the invisible biofilm. Think of this like the plaque on your teeth. You brush every day, but you still have to go to the dentist every 6 months to have the bacterial biofilm, i.e. the plaque, removed. Your lids are just as susceptible to biofilm, and if you have a Demodex infestation, reddened lids from blepharitis, or meibomian gland dysfunction, you definitely have a biofilm on your lids. Two types of lid exfoliation are a chemical type and a mechanical. So this is not unlike how it is in skincare. You may have seen these devices that brush your skin and mechanically exfoliate, or the old school apricot scrubs that had bits and pieces of apricot to mechanically exfoliate. And that's compared to a chemical exfoliation like an AHA or a glycolic acid that's more gently exfoliating the skin. So in eye care, that chemical exfoliation is called Zest. And I like Zest. It's from a company called Zocular. It provides a really nice chemical exfoliation of the lids, while BlephX is a great tool for the more advanced mechanical cleansing of the lids. Next, we've got light therapies. And light therapies have been shown to kill Demodex mites, improve the secretion of the meibomian glands, reduce ocular surface inflammation, and reduce the inflammatory effects of rosacea. They can rejuvenate the meibomian glands and are very effective at improving the signs and symptoms of dry eye disease. So I personally use the Luminous M22 IPL regularly in my clinic for the treatment of the glands. Intense pulse light has been used for over 20 years, with over 50 studies demonstrating its efficacy in dry eye disease. It targets pigment, so it's very effective in patients with rosacea at decreasing the amount of telangiectasias, or tiny blood vessels, present on the skin. We know that the presence of ocular surface inflammation increases with increased telangiectasias on the face. By treating the face for these abnormal blood vessels, ocular surface inflammation decreases. In addition, IPL changes the secretion of the meibomian glands and even rejuvenates glands that have begun to atrophy. It decreases the population of Demodex mites, and I'll link you my favorite YouTube video of all time above that shows IPL killing a Demodex mite. After IPL, tear breakup has been shown to increase, which is a good thing, and symptom scores also improve. Now, this mimics what I've seen in my patients as well. IPL has truly helped more than anything I've used in the past 12 years of treating dry eye patients. IPL has helped my patients and created more improvement than anything else. And so I know it tends to be out of pocket and very expensive, but IPL is just, there's nothing like it that we have yet to help with dry eye. It truly, truly helps everybody. And then finally, we have heat and expression. And this is critical to clearing the obstruction related to meibomian gland dysfunction. Remember, I said you have to control inflammation and you have to clear obstruction, or else you're not really doing anything for your dry eye. And oh, how I love my device, TearCare. Let me count the ways. TearCare is a blink-assisted warming device that delivers heat to the meibomian glands. The sterile disposable wearing elements are attached to a small portable heating hub that delivers 45 degrees Celsius of heat to the eyelids for 15 minutes. And this is critical. This is very carefully calibrated by the company, because your meibomian glands have to be at a very specific heat for a very specific amount of time in order to be expressible. The heat temperature is adjustable, and patients can keep their eyes open throughout the entire procedure. And that's in contrast to some of the other lid warming devices where your eyes are closed or you even have something in your eyes. This is very comfortable. I've had patients read a book throughout their treatment, and I find that that makes all the difference. This is something that's really, I would almost say even enjoyable. I set my patients up in a recliner or on a spa bed, and this is doesn't feel like a doctor treatment. It feels very, very comfortable to have TearCare done. So within 3 minutes after the heating session, that's when I clear your meibum manually with a clearance tool. And this allows me, the clinician, to spend as much time as necessary to evacuate your meibomian glands. And when you see someone like me, I know where you have good viable glands versus where you might have dropout, and I can spend more time on the glands that are obstructed, and it really allows for that customization of your expression treatment. And that's why I love TearCare so much. So when compared with at-home warm compresses twice a day for 4 weeks, TearCare was superior in improving your tear breakup time 1 month after the procedure. and a second procedure at 6 months was found to be beneficial in improving the signs and symptoms of meibomian gland dysfunction and dry eye disease in a study. Initial results of the Olympia trial, which compared TearCare to LipiFlow, showed that 76% of women noted improvement in symptoms after 1 month, compared to 56% of women who received LipiFlow. These new technologies are rapidly bridging the gap we've had for a long time in the treatment of dry eye disease. So when used appropriately in conjunction with an at-home regimen curated by you and your doctor, as well as the right biochemical interventions in the form of dry eye medications, you can get a lot closer to feeling like you found your dry eye cure. So let me know what, if anything, has cured your dry eye down below, or if you're still searching for that right combination for you. That's going to be it for today's iSchool lesson. Class is dismissed. I'll see you next time. Just fidgeting. I got a lot of energy. Okay. So when used appropriately with an at-home Why? Regimented? Why? Okay.